Welcome, everyone, to the Innovation Showcase. My name is Christina Wong, and I lead the Healthcare and Life Sciences Product Marketing vertical at DocuSign. For the past 4 years, I've had the privilege of bringing new products to market, including this new product functionality with our partners that I'm here to show you today. My journey in healthcare and technology started over 20 years ago. I've worked in the public sector, the private sector, and nonprofits, including the California State Legislature, Johnson & Johnson, Del Monte, and various venture-backed startups. I am so thrilled today to welcome three esteemed leaders in the healthcare industry, and they are going to showcase DocuSign's solution in healthcare focused on interoperability and improving the patient, the clinician, and the staff experience in order to accelerate the pace of business in healthcare. Now, more than ever, the healthcare industry needs DocuSign. The industry has been through significant strain, but despite the strain that they've been under the past few years, technology has been a driver in bringing our industry to a new beginning. Whether that started a long time ago with wearables and getting patient data, to the acceleration of telehealth during the COVID-19 pandemic, to now what's really top of mind for all of us is the possibilities of generative AI. Technology adoption has been critical in driving the healthcare industry forward. And not to mention, that's super important for us right now in this discussion today, is all of the changes in the regulatory environment around interoperability. A couple years ago, with the 21st Century Cures Act passing, patient data needs to be more portable, and that is what we're here to address today. Streamlining the care continuum with the patient at the center through technology. But let's not forget that even though technology is getting adopted in the healthcare industry, at the forefront really needs to be the patient. Here you'll see a quote from our customer, Dr. Kathleen Benton, President and CEO of Hospice Savannah. And she has shown that research has shown that if you can even get an extra 3 to 4 minutes of extra time with your patient, it leads to potentially better outcomes, because it really is in those pregnant pauses that the truth is revealed. This is why we're here today, to make technology easier, trusted, and smarter, to help staff, clinicians, and patients be at the center to get that extra minute that will ultimately improve patient outcomes. Yet there is something that we really need to focus on that's holding the industry back. And that's really something that I don't think we discuss much in the industry when we're talking about patient experience, and that is agreements. Agreements underpin the patient and staff experience. It underlines all of these processes. You might typically think of your legal processes, but really, when you need to bring in a new patient and bring them on board, that requires a lot of paperwork. Credentialing new doctors and bringing them in is an extensive amount of paperwork. Contracts between providers and insurance companies and negotiating that have a lot of agreements underpinning it. These are really what underpins the slowness in healthcare. 70% of the industry still uses fax. And that is very important because we still need the fax machine, because it's a cheap way to communicate between different entities. But we know there are opportunities for improvement, and we know these improvements are really going to help us improve the silos and bring care into a true continuum, which is why we are discussing today this concept of the three-legged stool. Our partner, Luma Health, thought of this framework called the three-legged stool, in which we connect the system of agreement with the system of record and the system of engagement. This is why DocuSign has upped our game in EHR interoperability. I am thrilled to announce today that DocuSign can connect to any EHR, and that this is connected to our patient forms. This is in order to drive our digital front door, to improve automation, and to have better connected health. This is by connecting, again, the system of agreement, system of record, and system of engagement. And you will see with your own eyes today in our showcase that this vision has become a reality. You'll see that we can connect to the EHR through 3 different ways. That's right. We can connect to Epic and Cerner and all of the EHRs, because now we can truly create a system of agreement, and we finally unlocked the last piece of the puzzle to be able to connect all of these agreements together. The first part of the showcase that we're going to show is our partner Infor Cloverleaf. York Schwartz is the Senior Director of Strategy and Solutions for Healthcare Interoperability at Infor Cloverleaf. He has been working in healthcare interoperability since the 1990s. He's built some of the first PAC systems and the first regional health exchanges. At Infor Cloverleaf, he is bridging the gap between the old world of HL7 v2 and the new world of HL7 FHIR, APIs, and orchestrated workflows that enable value-based care. Our second showcase is going to feature our partner Know2. Travis White is the SVP Market Strategy and Adoption for Know2. He brings over 2 decades of expertise in the enterprise and healthcare IT industry, and he drives strategic initiatives to improve healthcare incomes. And our third partner that we're going to showcase today is Luma Health. Aditya Bonsold is CTO and co-founder of Luma Health. He leads Luma Health's technical and strategic direction. He has over 15 years of experience as a product management leader developing mobile solutions at Microsoft and at venture-based startups. I am very excited for you to see our interoperability showcase today, and we're going to start with our out-of-box solution with Infor Cloverleaf. York, take it away.
Thank you so much for the introduction, Christina. And as you said very capably, I've been doing interoperability for a long time, and that's why I'm very, very excited about the type of interoperability that brings true patient satisfaction and increases the way how patients can interact with the healthcare system today. So let's look at the slides, please. Somebody said interoperability is a team sport, and this is really what we're showing here today: seamless workflows across the care continuum. It starts with how the patient engages before they even get to the hospital and can already sign forms before they ever enter the hospital. This is made possible by Luma and Cloverleaf with DocuSign. Cloverleaf is the #1 integration platform used by about 1/3 of the hospitals in the United States and thousands of hospitals around the world. So when we get the documents, we integrate them right into the EMR system. And we can also integrate other workflows into ERP systems. So there's a seamless connection when the patient gets to the hospital. They do not have to sign a lot of paper forms or send faxes or do all this paperwork. They can really engage with the care providers on what really matters. And then after the patient goes into post-acute care, or even if the patient engages with pre-acute facilities, Know2 is there and is the interoperability provider there. And again, the data needs to flow from acute to post-acute or from pre-acute to acute care. And this should all be seamless for the patient. And that's really what the consortium that is doing the presentation here today, Luma, Know2, Cloverleaf, and all in concert with DocuSign, enable. Let's go through the workflow. It starts all when the patient schedules an appointment online or when the appointment is scheduled in the EHR. This kicks off a workflow where the paperwork is sent out via email or SMS. And then the patient has the chance to complete the paperwork, review the paperwork, and sign the paperwork through DocuSign remotely. There's no paperwork necessary anymore in the waiting room. The information is accurate because instead of filling out a paper form that then has to be transcribed or transposed into the EMR, the data can be digitally received. The data was already there. Now you have a document with a signature that can be attached to this. And all the time when the patient comes to the hospital can be spent on patient care. The visit is focused on treatment and the experience of the patient. And then after the visit, the follow-up paperwork can be triggered, and the paperwork is already pre-filled with all the information from the visit. So this is how we can enable an automated workflow where the documents are sent electronically and signed electronically. With that, I would like just a quick overview of Cloverleaf. So Cloverleaf is the #1 clinical interoperability platform globally. We connect hundreds of EMRs. This is why Christina says with confidence that now DocuSign can connect to all the EMRs, inpatient and outpatient EMRs. This is what Cloverleaf has been doing for over 20 years. We also connect with the ERP, which is where contract management happens for hospitals, so we can enable those with DocuSign as well. So while we cover the acute care side, obviously also important for the care continuum is the pre and post-acute side. And I'll hand it over to Travis, who will walk us through what Know2 is doing in the pre and post-acute space. Travis, over to you.
Yeah, thanks so much, Jorg. Appreciate that. As Jorg had mentioned and Christina alluded to earlier, been in interoperability for quite some time. Representing Know2 here as the Senior Vice President for Market Strategy and Adoption. My passion is the people. My passion is how can the technology actually equip the people to do more, which is one of the reasons I'm excited about the conversation we're having. It really does position both the patients and the providers to experience a streamlined and efficient workflow, whereas before it's been asynchronous and disconnected and disjointed and really plagued with problems. So happy to jump in and tell you a little bit more about Know2 and relative to the Know2 reach. So Know2's reach and the breadth of our platform, we represent the bulk of post-acute, pre-acute behavioral therapies, whether that's even in vision or in ambulatory spaces. But Know2 sits as the interoperability layer or the core communication layer and connectivity for these clinical systems. And so by being Know2 connected, these EHR systems are positioned, as is their user base, to actually leverage and advance the workflows that they can employ with DocuSign. So you can imagine a signature workflow inside of a pre or a post-acute interaction or a behavioral or perhaps a specialty provider. Leveraging their existing system, their EHR, they're able to actually execute a workflow that keeps them inside that product by using the Know2 connectivity that they already benefit from today. If we jump into a little bit more detail, I can talk through the provider-to-provider exchange. A provider can anticipate being able to stay inside of their clinical EHR, execute a signature workflow or a signature request between another exchanging provider. Maybe that's a recertification of a care plan. Where that provider actually can route the document for signature. And then upon executing that signature, that provider that has signed will complete that signing ceremony. When that signing ceremony is completed, the system is actually already configured to automatically package up all of that content, the metadata in that transaction, and deliver it back into the sending system of record. And so if we think about the three-legged stool that they were referring to earlier, you can imagine that the system of agreement and the system of record and the system of engagement, all relatively native for these individuals involved in this signing ceremony, are all benefiting from the streamlined workflow that's unfolding, not having to go log out to some other system or execute it out of line from where they're actually doing their day-to-day work. If we flip that persona and we think about the provider-to-patient interaction, you can imagine as a patient yourself, how many pieces of paperwork that you've had to fill out over and over the same way, same time, every single time you go see a provider. Well, in a DocuSign workflow where that experience has been digitally uplifted, we actually are able to allow that provider or that scheduling entity to actually send out a signature request. Maybe it's an admission intake packet, maybe it's a packet before a procedure that needs to be filled out by the patient. You can imagine that the patient will get an experience that they're very familiar with. They'll be able to execute that paperwork inside of DocuSign, and the clinician never had to leave the EHR. But by doing so, they're able to trigger that signature request. It routes to the patient. They get an alert, and upon completion, we then package up all of the nuanced metadata in that transaction, and then we turn around and we deliver that completed set of documents back to the clinical system of record. Now we move to the next leg of the stool. So the third leg, the system of engagement. I'm going to turn it to our other partner here, Aditya, to talk to you more about what Luma is doing in this space.
Awesome. Travis, thanks so much. Appreciate the introduction. Really excited here to speak to you all today about Luma Health, how we provide that system of engagement to allow patients to connect and put them at the absolute center of the journey. So let's jump on in and take a look at how we help with that. So Luma Health, we're in the business of solving this problem right here, the one you see on your screen, which is the great patient disconnect. No matter the best intentions of patients, providers, plans, payers, systems, technology vendors, no matter what, we all have our best intentions in mind, but patients fall through the cracks. So if you look here, this is an example of an actual message that transacted on, that we had a patient show us that transacted on another platform, which shows a digital dead end. Patient really wanted to take an action, wanted to take an activity, wanted to complete that moment of transaction, and they got a no reply message. How many times have we seen that and been disappointed in that experience that a system or a vendor or a consumer experience that we went through had happen? However, what we aim to go solve at Luma, you'll see on the next slide, is what we call the great patient disconnect. We want to solve it with patient success. Solving this problem is the raison d'etre, the reason that Luma exists. We want to go beyond engaging patients and actually guiding them to be successful. We want to take those best intentions of patients, providers, plans, payers, and you name it, and actually help guide those patients to that moment of success. So here we see a patient. This is actually a DPHI version of a conversation that happened on the Luma platform, which a patient said, hey, I want to follow up. You have a follow-up appointment. That's what a health system had said. They said they need to reschedule. And then immediately with that, a set of options are provided to the patient. Patient's able to make their way forward in this digital engagement journey in order to provide that system of engagement that allows them to complete those various actions they need in order to be successful. So Luma Health, a little bit about us. We are a leading vendor of these solutions towards healthcare systems, whether it's large county systems like Cook County Health, large systems in the Bronx and Hudson Valley with Montefiore, or large academic-based systems such as university hospitals, about 23 different hospitals in the Cleveland area. We provide these services to enable patients to get access to that care across all different care modalities, across all different geographies across the United States. To do that, we require a large set of partners. Healthcare is not an island. It takes a partnership and it takes a village to get a patient from the moment they want care to the moment they can receive care and start their path to being healthy and happy. Whether partnerships in the electronic health record universe, such as Cerner, Meditech, and the like, or our partnerships here with DocuSign, which we'll be talking a little bit more about briefly, that really help enable this ability to connect the patient along all those points that they need to get access to care. Luma provides a rich set of solutions that make it easy for every use case from the point where I, Aditya, as a patient, want to get access to care. We can produce the tools to help those workflows that help the patients get to that care moment. So in our partnership with DocuSign, the work that we've done is to intimately and deeply integrate DocuSign, the system of agreement, into those patient-facing workflows. So whether a patient got that appointment reminder, like we saw earlier, where they rescheduled it, were there any forms and documents they needed to sign pre-service in order to get access to that care? Whether it's in the pre-service universe, whether through a wellness reminder, or maybe even during a care episode where they're in front of the doctor and they need to sign a consent form for an in-office procedure. These various points along the journey, Luma and DocuSign have partnered together very, very deeply to take DocuSign's capabilities of engagement and signature and agreement and make them seamlessly integrated into the workflows that patients engage with every single day in order to make those connections happen to get the patient into care. Luma transacts over 1 million of these kind of conversations with patients every day to 35 million patients across the United States. And DocuSign helps power a key capability of that to help make patients have a more consumer-friendly experience where they will no longer hit a digital dead end and where they can actually be on their way to success. And over to you, Christina.
Thank you so much, Aditya, for that there are multiple options for DocuSign and our EHR interoperability. I am so thrilled to have worked with each one of these partners as DocuSign continued on our journey to be able to truly provide a platform solution for the healthcare industry. Of course, the number one thing to remember is that human connectedness really remains paramount. Technology is not helpful unless we are giving time back to you all to do more with less. This is really about leveraging the technology and solutions that you have in place today. It's about connecting these three systems together: the system of agreement, the system of record, and the system of engagement, to really help that patient be connected across the care continuum, to have automation, and to have that digital front door that they have come to expect. And of course, this is all to address the huge staffing and margin tightness that we have in the industry today. I really hope that you can see that DocuSign has finally lifted these barriers that we've had before when you've asked us, can you connect to our EHR? The answer is yes. There is not any more time than now where DocuSign, Infor Cloverleaf, No2, and Luma Health can say yes to you. I really hope that you enjoyed this presentation and that we can finally work together to really help you meet the needs and to adopt technology with the patient at the center. Thank you so much.